Hey everyone, Eileen Veilleux The Fam here. Welcome to episode 2, dealing with major depression disorder in our little mini mental health series. In today's episode, we're going to be covering the causes, the risk factors, complications, and prevention of major depressive disorder. So let's get started. It's not known exactly what causes depression. As with many mental disorders, a variety of factors may be involved, such as biological differences, brain chemistry, hormones, inherited traits. Before we continue, I'm going to go over exactly each one of these that I just mentioned. So the biological differences is people with depression appear to have physical changes in their brains. The significance of these changes is still uncertain, but may eventually help pinpoint causes. Brain chemistry. Neurotransmitters are naturally occurring brain chemicals that likely play a role in depression. Recent research indicates that changes in the function and effect of these neurotransmitters and how they interact with neural circuits involved in maintaining mood stability may play a significant role in depression and its treatment. Hormones. Changes in a body's balance of hormones may be involved in causing or triggering depression. Hormone changes can result with pregnancy and during the weeks or months after delivery, better known as postpartum, and from thyroid problems, menopause, or a number of other conditions. Inherited traits. Depression is more common in people whose blood relatives also have this condition. Researchers are trying to find genes that may be involved in causing depression. So those are all the different causes, and they're explained in detail. Now we're going to cover the risk factors. Depression often begins in teens, 20s, or 30s, but it can happen at any age. More women than men are diagnosed with depression, but this may be due to a part because women are more likely to seek treatment. Factors that seem to increase the risk of developing or triggering depression include certain personality traits such as low self-esteem and being too dependent, self-critical, or pessimistic. Traumatic or stressful events such as physical or sexual abuse, the death or loss of a loved one, a difficult relationship, or financial problems. Blood relatives with a history of depression, bipolar disorder, alcoholism, or suicide. This I didn't even know. Being lesbian, gay, bisexual, or transgender, or having variations in the development of genital organs that aren't clearly male or female, intersex, in an unsupportive situation. History of the mental health disorders such as anxiety disorder, eating disorders, post-traumatic stress disorder, alcohol or abuse of recreational drugs, serious or chronic illness, including cancer, stroke, chronic pain, or heart disease. Certain medications, such as some high blood pressure medications or sleeping pills. Talk to your doctor before stopping any medications, though. Excuse me. Complications. Depression is a serious disorder that can take a terrible toll on you and your family. Depression often gets worse if it isn't treated. resulting in emotional, behavioral, and health problems that affect every area of your life. Examples of complications associated with depression include excess weight or obesity, which can lead to heart disease and diabetes, pain or physical illness, alcohol or drug misuse, anxiety, panic disorder or suicide phobia, social phobia, family conflicts, relationship difficulties, and work or school problems, social isolation, suicidal feelings, suicidal attempts, or suicide, self-mutilation, such as cutting, premature death from medical conditions. And before I go on, if nobody knows what cutting is, it's a person that will take like a razor blade or knife and they'll go like right, let me get this in view here. Okay. They'll slice like right here, you'll see, scars. That's what a cutter is. They're not actually trying to commit suicide completely. They just take a razor and constantly cut, and it's not deep enough for suicide. That's what a cutter is, for those that may not know. Now, for the prevention, because there is prevention for major depressive disorder. There's no sure way to prevent depression. However, these strategies may help. Take steps to control stress, to increase your restlessness and boost your self-esteem. Reach out to family and friends, especially in times of crisis, to help you weather through tough times. Get treatment at the earliest sign of a problem. That one's very important. Always, when you have early signs of depression, please go seek medical attention. This will help you to prevent depression from worsening. Consider getting long-term maintenance treatment to help prevent a relapse. And those are, that will cover everything from the cost to the prevention. There's a lot more to cover, but I don't want to give you too much at one time. I want to make these videos kind of short so you can understand everything, so you have a better understanding of it. Because depression isn't just a case of the blues. I will give you an example. As I stated earlier, I went through depression when I was a child. I learned, I handled it, and every once in a while it may come back on its own. And then, when I grew up, I had more depression. When I lost my husband, it came back full force then, which almost killed me. But then just recently, I had a bout with depression yesterday. Real bad bout. My youngest daughter, who I had to give up for adoption when she was 5, has been reaching out to me, which is great. That's not what caused the depression. But the way she's reaching out to me is through email. And the problem is there's not enough trust for her to give me her phone number so we can text back and forth, but there's enough trust and to a point where every time I receive an email from her, she's asking for me to buy her something. Which it really hurt because she was my youngest, which is my baby. And we had her the longest. And it made me feel like she didn't want to get to know me, and she just wanted to know my pocketbook or my wallet. Because, like I said, every email she was giving, that she was sending me, it was, can you get me this? Can you get me that? Can you get me this? Can you get me that? And those were the only emails I was getting. So it felt like a knife. I got really depressed, but I was able to snap out of it. But it took me a little bit. Even when I did my live stream yesterday, I was kind of slow to respond to things and kind of still not with it. I was kind of half out of it. But it took talking to my friends. And let me mention there, two of them are two great people on YouTube, Gill Skills and R5 Adventures. They took time out of their work days and their busy days, and they talked with me about it. Green Bay Wacky showed concern and talked to me. I got to talk to my other son. He talked to me for a good hour and a half. So it took a group of people to help me out of my depression because I was hurt so bad that it put me in tears. Thankfully I got the situation resolved with my daughter, I hope. We will soon see. But that just goes to show you, like we said Monday, you only get depression one time in your life. But the thing is you have different episodes of it throughout your life. It won't be just that one time. Depression doesn't have a schedule. Everything could be fine. People don't understand this. Anybody that has anxiety or depression or any type of mental illness, it doesn't, have a schedule. Things pop up and can trigger it. Anything can trigger it. So always remember to see with your heart and not your eyes, and keep that in mind. And, my daughter was seeing me through her eyes and not her heart, because her adopted parents did not teach her how to see from her heart. My boys, on the other hand, they do see with their heart. And it's been a proven fact that anybody that has a mental or physical handicap always shows true, genuine love and acceptance compared to those that aren't handicapped in any shape, form, or matter. Because non-handicapped people have to be taught how to see with your heart and not the eyes, because it's not a natural thing to them. But being handicapped is, because you know what it's like on the other side. You know what it's like to be prejudged. And you don't wish that on anybody. Handicapped people, whether it's physical or mental, can be the most loving people. So always remember, it is so important, especially with depression, because, with a lot of these mental disorders, depression is part of them. And as being part of it, that means their risk of suicide is greater. So we need to take more care that we don't trigger that, and that we help them out of it by lifting them up, encouraging and inspiring. Because when we tear somebody down, you don't know if they have major depressive disorder, you don't know if they're bipolar, you don't know if they have autism. You don't know what is going on with their life. You don't know what type of situations they're in. They could have been a war veteran and suffering severe PTSD. They could have lost somebody really close to them and is losing it. And by you saying something that you may think is trivial, could be that straw that breaks the camel's back. And so please, I'm talking to you out there. Yeah, you. Please. Always see with the heart, not with the eyes. Because what the eye sees is not important. What is truly important is invisible to the eye. So try to remember this in your daily activities. It's much easier and healthier for everybody. As I said before, when you uplift somebody and you make them smile, you release endorphins inside of you as well as them. And these endorphins help heal your body physically, mentally, and emotionally. So it's a taste of medicine just to uplift and inspire and encourage. Plus, nobody really wants to be around negative people. I know I'd much rather be around happy people. When I see drama, I walk away from it. So please, try to always be as loving as you can and keep the other person in mind. Don't judge them by what they wear, the way they walk, the way they sing or talk or dress or anything like that. Look deep. Look deep into their heart. And then, and only then, can you know what that person is like. So until I see you next time, remember, you matter to me. Yes, you out there. You're important because you were uniquely created. You're uniquely made. You're one of a kind. There's nobody else like you. And I love you just for you. So until I see you again, mwah.